Good day. This session will briefly tackle on capillary blood glucose monitoring and interpretation. Blood glucose monitoring observes for patterns of fluctuations of blood glucose levels associated with any pathological process or certain clinical condition. Unusually high or low blood glucose levels can potentially lead to acute or chronic life-threatening conditions. Infants, children, and adolescents whom blood glucose metabolism might be put into dysfunction should be regularly monitored to observe for fluctuations and patterns. Critically ill patients, especially those on NPO, infants born to diabetic mothers, too small or too large newborns, those with hormonal deficiencies, and diabetic individuals are candidates for this procedure. A blood trap sample is usually collected from a fingertip prick, but it can also be sourced from alternate sites such as the heel, earlobe, forearm, or palm, which can provide similar results. There's also continuous interstitial fluid glucose monitoring, which involves applying a water-resistant disposable sensor on the back of the upper arm or abdomen. The sensor can remain on the patient for 3 to 14 days, depending on the product, and it can be scanned with a reader which displays the patient's current and trends in the last 8 hours of interstitial fluid glucose levels. CGM machines can store 90 days of glucose data, which could be shared with family and care provider via a smartphone device application. These devices are often capable of sending alarms or messages of alerts, including hypoglycemia. Generally, normal capillary blood glucose ranges from 4 to 6 millimoles per liter, or its equivalent 72 to 108 milligrams per deciliter. To avoid occurrence of neurologic, intellectual, and psychologic sequelae later in life, CBG below 3 millimoles per liter or 55 milligrams per deciliter should be vigorously treated. This is particularly applicable after the initial 2 to 3 hours of life, when glucose normally has reached its nadir. Subsequently, blood glucose levels begin to rise and achieve values of 50 milligrams per deciliter or higher after 12 to 24 hours. By day 3 of life in normal full-term newborns, blood glucose averages approximately 60 milligrams per deciliter. In older infants and children, counter-regulatory mechanisms are activated at this hypoglycemic level. This slide shows the classification of hypoglycemia among infants and children taken from the Nelson Textbook of Pediatrics with the page indicated above. Premature and SGA infants are vulnerable to develop hypoglycemia due to inadequate stores of liver glycogen, muscle protein, and body fat needed to sustain the substrates required to meet energy needs. These infants are small by virtue of prematurity or impaired placental transfer of nutrients. You may refer to our main reference for the brief discussion of the other classification or causes. Once hypoglycemia is recognized through properly done monitoring, knowledge of the basic algorithm for the condition would be helpful in determining the most probable etiology. Meanwhile, fasting glucose ranging from 6 to 6.9 millimoles per liter or 100 to 125 milligrams per deciliter is considered impaired. For those who can undergo an oral glucose tolerance test, such as the older children and adolescents, levels ranging from 7.8 to 11 millimoles per liter or 140 to 199 milligrams per deciliter is likewise considered impaired. These levels are called pre-diabetic range, rendering the individual an increased risk of developing diabetes. Random blood glucose reaching 11.1 millimoles per liter or 126 milligrams per deciliter or more is said to be in the diabetic range, warranting further investigation and treatment. For diabetic patients, once diagnosed, the goal is to maintain their blood glucose levels in the following ranges depending on the age group. CBG monitoring is a useful aid in guiding treatment adjustments among diabetics, most especially during periods of instability such as illness or stress. To sum up, capillary blood glucose monitoring is a simple yet very useful procedure to track down regulatory patterns of glucose metabolism of an individual. The values taken, when interpreted accurately, would help not only in the diagnosis of a previously unknown condition, but also in adjusting management strategies to optimize treatment outcome.